What can be done to prevent arterial blockage? I think it's most frequently associated with oxidized fat intake. Elevated homocysteine can be a factor causing problems. So here antioxidants would help, here lipotropic adjunct. Low testosterone and the phospholipids actually slow this progression as we age. Men tend to lose testosterone. The phospholipids can slow that process of decline. Then excessive sugar intake can contribute to magnesium deficiency, which has been shown to contribute to arterial blockage. One of the criteria for an indication that someone's developing arterial problems is a crease in the earlobe. And that crease is an indication that there's a lot of blood vessels in the earlobe, so creases in the earlobe can indicate that there's some oxidative damage going on. This really is one of the key things on heart disease. This fellow headed Magnolia Laboratory, Robert Ford, and he wrote way back in 1964 that stale food was the key factor involved in heart disease. And if people would simply eat fresh, live food, we wouldn't have all the heart disease problems that we do. The number has nothing to do with the lottery or the stock market. It's your cholesterol level, and it's 956 trillion here. And this whole thing about cholesterol, all the early studies on cholesterol were all done with cholesterol. It was stored in jars, it was oxidized, it was in some cases years old. When they repeated these studies in the 1970s and they used non-oxidized cholesterol, they found that the oxidized cholesterol increased the risk of atherosclerosis 500-fold over consumption of non-oxidized cholesterol. So the real danger is not cholesterol itself. Cholesterol is an essential nutrient for healthy brain function. But it's the oxidized cholesterol, it's the powdered eggs, it's the aged cheeses, it's the aged meats, the highly heated oils that are the problem. Homocysteine we've talked about. High sensitivity C-reactive protein is a test that you can have done to see if excessive inflammation is going on in your body. We actually have standards of what those should be. Here's all the consequences of low testosterone. It looks very much like a heart disease victim. Phospholipids really make a difference. There's also an infectious component. Unhealthy gums and teeth can contribute to heart disease.